Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. We bring you this program Monday through Friday and we try to highlight trending health issues from around the world. Today we are looking at prostate cancer, one of the most common cancers in older men. We'll get to know more about this disease in a moment. Please stay tuned. It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Temitope Andero, Consultant Clinical and Radiation Oncologist at NSIA-LUTH Idi-Araba. Good evening. Thanks for joining us, Dr. Andero, and thanks for always finding time to join us.
Good evening, and thanks once again for having me around. It's my pleasure.
All right, Dr. Andero, please tell us, what exactly is prostate cancer? We hear about colon cancer, cervical cancer. What exactly is prostate cancer?
All right, prostate cancer, we are talking about a disease entity called cancer that affects the prostate. And by the way, what is a prostate? A prostate is an organ that is found among male individuals or anybody that is biologically male, with emphasis, because of course nowadays we have people who could choose to be male or female, but we are talking about people who are born biologically as male. So prostate is a small organ that is below the bladder. And and when this organ, for whatever reason, becomes certain cells, they undergo certain transformations in such a way that they continue to grow uncontrollably, and not just that, in such a way that will kind of distort the physiological and the anatomical function of this organ, and of course, by extension, relevant investigations carried out, and then it's confirmed malignant or cancerous, and then we, come out and say categorically that, okay, this organ is cancerous, and then we'll talk about prostate cancer. And talking about prostate cancer, it is the most common cancer found among men. As we have breast cancer for women, the most common cancer among men globally is prostate cancer. And, it is a global burden, as it were.
All right. Unfortunately, the World Health Organization says we are seeing an increase in this type of cancer. Why is this so? Let's look at that before we talk about the symptoms.
Oh, yes. Well, like other, malignancies, so we, the incidence of cancers, generally prostate cancer included, is on the rise. Especially in the third world country. And this is not connected to certain factors. Notably, we are beginning to have more awareness about this disease because of such programs like yours. So, and then because of increase in awareness and screening, that of course apparently can also impact on, the incidents. We are beginning to have more, discoveries. Aside that, there will also be other factors like, exposure to certain, carcinogenic entities, and that might even take us to, what we call the risk factors. Because as it stands, the common question would be like, what is the cause of prostate cancer? The causes are not known. But then there are what we call the risk factors. And this, of course, includes aging. And this disease is found more among individuals from age 50, 55, 60, and above. Right. So, and then, of course, it's also common among Black race, African American and Black race, and of course, it is also noted that the prognosis is also poor among this, group of people, right? And it can also be, this can also be hereditary. And it can be, in other words, there is a risk among first degree, relatives. In other words, if father has cancer, the risk of prostate cancer is much higher among the male children or the brother of the individual. So, so the presence of all these factors will also impact on, the incidence and the rise, as it were, especially in the third world.
So what are these risk factors, and is this why we are also seeing more younger men below age 55 coming up with prostate cancer?
Well, as mentioned earlier, I highlighted earlier, the risk factors, and the chief among them were, like I said earlier, aging, right? And of course, I did mention, race and ethnicity. Actually, it's more common among Black people of African descent, right? I also talk about hereditary. Well, finding or diagnosing individuals below 40 or around that age sometimes, could just be due to, nowadays, like I said, where we are beginning to have more screening being carried out as opposed to the way it was before. So that could give an apparent, feeling of having an increase in the rise. However, it could just simply be due to the fact that, more people now are more, people are now beginning to have more access to screening. And sometimes one could even, we might talk about over-screening sometimes. So, and that is why, according to American Association of Urologists, screening below age 40 is not recommended.
Okay.
However, when you have when you have an individual at a much higher risk, like I mentioned earlier to you in the course of highlighting the risk factors, people with prostate cancer in the family, of course, might encourage them to get screened anywhere from above age 40 to 45, or Black race generally. So, so the screening, availability of screening might give, that impression of an increase in incidence,
Okay.
right? So, but which might not be necessarily so.
Okay. So tell us, what are the basic symptoms we should look out for? Because a layman would not understand what prostate cancer is. What are the basic symptoms I must, as a man, must look out for?
Yeah, thanks for that question. Well, at the early stage of this disease, it is asymptomatic. In other words, in the earliest stage, such individuals go all around without even noticing anything is going on until after some time when it becomes very, symptomatic. And the common symptoms, it ranges from urinary retention, whereby the patient, find it difficult to pee or have to strain, and then or having a very weak stream of urine, and then others could be like having to wake up in the night to pee frequently, and at some point the pee could also come alongside with some blood in the urine or blood after ejaculation, and for some it could just be some pelvic pain. And by the time it becomes way more advanced, then there are some other associated symptoms which could, be a red flag that probably the disease has now spread or metastasized, like you say, probably to the spine, which is usually the first port of call. At this time, the patient is having low back pain, and sometimes if diagnosis is not made on time and treatment is carried out on time, it will also ultimately result into what we call pathologic fracture, whereby you see a patient, the patient cannot walk. And in this part of the world, when we see patients presenting very late, it is not uncommon to see some patients being brought to the hospital, not being able to walk, and sometimes people who attribute it to they put some juju on the floor in my office or at home, my enemies have done this. It is only when they now come and we do proper investigation to discover that the PSA is touching the sky. And then you do the biopsy and then it contains, prostate cancer. And then other images will now reveal that, oh wow, this is also metastasized. So from not showing any symptom at all at the early stage, to urinary symptoms, to some, symptoms when it is already advanced, So those are the common presentations.
Okay, Dr. Andero, tell us now, is this disease treatable?
Oh, well, absolutely. So what we advocate and we try as much as possible to let the public be aware of is that, any detection is key, especially to every cancer. With early detection, of course, the prognosis will be much better. We have a better chance or chances of survival is right there. And specifically, when we talk about prevention and screening, what are we talking about? I did mention earlier about screening. And when we talk about screening for prostate cancer, specifically, the tool that is used universally and globally is an entity called PSA, prostate-specific antigen. It is a particular secretion that takes its origin from prostate cells, and this can be way more exaggerated in the setting of a malignant disease of the prostate. Normal is 0 to 4, but then by the time an individual is sent for a screening, and we are having a PSA of maybe 10, 20, 30, or even 100. There are times when for some, it can be as high as 1,000 or even more. It's a red flag that something is going on. So screening is key. And I did mention earlier that according to the Association of American Urologists, screening is not recommended below the age of 40. However, for individuals with a higher risk of prostate cancer, I'm talking about those with family history of prostate cancer, or a black man, or every individual of African descent, we are at a much higher risk. So in this case, we recommend that such individuals should do their PSA for their screening from between age 40 and 45 and above, right?
All right.
And then, so screening can help us to detect it very early.
All right.
So that's a certain screening. And then for treatment, of course, so treatment can be carried out at the point of diagnosis. And we have different, kind of treatment modalities. I always have to say teamwork, people with urology. So the indication for the kind of treatment modality it is individualized. Talking about the stage, and some other, parameters used to design the treatment protocol. So it will range from surgery, to radiotherapy, to monotherapy, to chemotherapy, depending on the stage we are talking about. So, yes, so of course it can be treated.
All right. In 30 seconds, your call to action.
There has to be more, awareness created through such a forum as this, in a way as to encourage people to go for screening, and that early detection is key. So, and that, more awareness, and there has to be more involvement of the, private organizations, religious bodies, and even the government, in a way as to be able to reach more unreached people, and, more facilities be made available where people can go and do screening at a, at a low or no cost at all.
All right, sir.
And this in a way can help to reduce the global burden of prostate cancer.
All right, sir. Dr. Temitope Andero, consultant clinical and radiation oncologist at NSIA-LUTH Cancer Center, Idi-Araba. Thank you so much for your expertise on how to prevent and reduce prostate cancer.
Thank you very much.
Thank you so much, sir, Dr. Andero. All right, I have been speaking with Dr. Temitope Andero, consultant clinical and radiation oncologist, on how to reduce prostate cancer in Nigeria and around the world. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. We now take a look at efforts at reducing malaria around the world. Prevention, they say, is better than cure. Ensure you look out for symptoms of prostate cancer early enough to get screening from the nearest medical health facility around you. If you have topics you'd like us to treat or comments, please send SMS to 0035826003 or follow us on social media at Lagos Television. A sound health is a sound mind. Make healthy living your choice.